Hello everyone, welcome to my channel. Today we will look at some differences between gastric ulcer and duodenal ulcer. This is a very common question asked as a short answer question for 5 marks. So, a gastric ulcer is usually seen on the lesser curvature of the stomach, whereas the site of a duodenal ulcer is the first part of the duodenum. Gastric ulcer is usually seen in older age, that is more than 50 years, whereas duodenal ulcer occurs in second and fourth decade, about 20 to 40 years of age. Gastric ulcers are common in female patients, whereas duodenal ulcer are more common in male. In a gastric ulcer, the pain increases after consuming food. Hence, the patient looks weak and loses weight if he is a patient of gastric ulcer. Whereas a patient of duodenal ulcer, there is relief of pain after eating. Hence, he tends to eat more. The nature of pain in a gastric ulcer is dull, heavy, and non radiating, whereas in a duodenal ulcer, the patient has a groaning type of pain associated with burning sensation in the chest, abdomen, and can radiate to the back. The time of gastric ulcer is immediately after eating food in about 60 to 60 minutes or half an hour. Whereas in a duodenal ulcer, the pain begins a little late or at night when the stomach is empty. The appetite is reduced in gastric ulcer, whereas it increases in duodenal ulcer. Vomiting may be present, and once the patient vomits, he feels better in gastric ulcer, whereas vomiting is rarely seen in duodenal ulcer. If present, then there is no relief after vomiting. There are no signs of acidity or gastritis in a patient of gastric ulcer, whereas in duodenal ulcer, the patient has excess acidity, chest pain, burning sensation, etc. The malignant potential is higher in gastric ulcer, whereas we will rarely see malignant transformation in a duodenal ulcer. Bye bye.